education, and healthcare. And we're true to our legacy. We provide opportunities to disadvantaged persons both for training and for healthcare. For 142 years, we've been committed to a mission of training future generations of physicians, dentists, and biomedical researchers with a focus on giving opportunities to students from disadvantaged backgrounds and students of color. Meharry has been and continues to be committed to providing outstanding healthcare services to the indigent and uninsured in Nashville. We've trained thousands of healthcare professionals who are highly respected in their communities for their technical skills, for their compassion, and for their commitment to the people they care about. The Meharry diaspora, consisting of over 7,000 alums, spreads all over the United States and indeed other parts of the world. I'm especially proud of the fact that Meharry Medical College is ranked number 2 among the 147 medical schools for social mission. We achieved that ranking because more than 80% of our graduates, both medical and dental, choose to practice in areas that are underserved. And not only that, more than half of our medical graduates choose a primary care specialty. Our impact in oral health and dentistry is no less profound, given the fact that we train 40% of all the black dentists who practice in the United States. You probably didn't know that. For these reasons and others, I think it's no exaggeration to say that Meharry Medical College has had and continues to have a profound impact on healthcare in Nashville, in the United States, I would even say the world. We're both a healthcare organization and an institution of higher education, and our mission to train physicians and provide health care are intricately interwoven. For this reason, we have to have an affiliation with a hospital to fulfill our teaching mission. Medical schools use affiliated hospitals where medical students gain knowledge and experience in treating patients. And at most medical schools, the affiliated hospital is a senior hospital, and they spend most of their time working with physicians as apprentices in different specialties, medicine, surgery, pediatrics. Because of low patient volumes and some other challenges, our affiliated teaching hospital, Nashville General, those issues, we have to send our students to more than 20 hospitals outside of Nashville and Tennessee and in other states, including Ohio, Kentucky, Alabama, and Michigan. While our students are getting a quality experience in these places, their training is disjointed, and we cannot make sure that there's consistency in their training. Not only that, we cannot be advocates for them and make sure they're getting the kind of experiences that we would like them to have. So, and this arrangement has been going on for quite a long time. That's why I'm extremely excited to announce that Meharry Medical College has entered into a partnership with HCA Healthcare for the training of our medical students at the Southern Hills Medical Center here in Nashville. Exaggeration to say that in all the history of Meharry Medical College, there have been some historic days. This certainly has to rank among those historic days because we have in this partnership the pairing of one of the premier healthcare organizations on the planet, I think it's fair to say that, with, in my humble opinion, one of the best medical schools. This means that for the first time in a very, very long time, our training activities for our students can be anchored right here in Nashville. And for the Meharry community, you know that my village cannot be a village. Y'all know what I'm talking about. Moreover, it's going to be anchored in a state-of-the-art hospital offering excellent care to the people who come here. Healthcare in the United States is undergoing some fundamental changes, both in how we deliver the care and how it's paid for. The old model of the physician being at the center of everything is changing to a patient-centric model where outcomes are more important than tests or procedures. Furthermore, there are looming shortages in physicians in this country, primary care being among those looming shortages. And HCA, as a premier healthcare organization, is responding aggressively to these challenges. And I would say in many ways, they're leading the changes and leading the way to make sure that these things are going to work. That adds to my excitement because my students will now be training in an environment that's state-of-the-art, and they'll get to learn medicine as it's going to be practiced going forward. And that also adds to my excitement as their chief cheerleader. And furthermore, you should know that HCA has a history, and I'm sure Mr. Johnson is going to expound on this, of having students and residents train in our hospitals. So we're partnering with an organization that understands the challenges and opportunities presented when students are present. It's no accident that the best hospitals in the United States are teaching hospitals, at least according to some people. And I believe that one of the reasons for that is that when physicians are surrounded every day by young, bright minds asking questions, stimulating them, keeping them on their toes, that can be a powerful thing. And that also adds to my excitement about this partnership. I'm also bolstered in my excitement by the fact that this is an organization that's committed to diversity and committed to providing indigent care to people in their communities. As a matter of fact, in most of the communities they're in, they happen to be the largest provider of indigent care. If you look at their website and look at the leadership in our hospitals, you can actually see there's also a commitment to diversity. So we're partnering with an organization that shares our mission, shares our values, and in a lot of ways we've been associated with them for a couple of decades. Meharry alumni work in HCA hospitals. They've done that for a while. HCA leadership has served on our board, and currently the Chief Medical Officer of HCA serves on our board. And conversely, leaders from Meharry have served on the HCA board. So our association with HCA is long-standing and broad and deep. That adds to our comfort level of partnering with this amazing organization. Nashville, as you know, has one of the strongest healthcare ecosystems in the country. 3 large organizations, and then there's us. But we have a special place in this ecosystem, one that's just as valuable as those larger organizations. But when you're in an environment that is changing, and the pace of change is changing, you don't have a lot of resources. My strategy is partnerships. And this is just the latest of a series of partnerships that will allow us to leverage our legacy, leverage our strengths to be better at delivering on the mission that we all share, which is providing the best care to the people that we take care of, providing the best training to the students that are in our charge. So on many, many levels, no matter how you look at it, this is a really historic day. And I'm just proud to be Meharry's president at the time that this has happened. And it's important for me to point out to all of you and to anyone who's listening that we remain committed to this community that we've been a part of for 142 years. Our address is 1005 Dr. D.B. Todd Jr. Boulevard, and it's going to be our address for the foreseeable future. We're not going anywhere. You need to know that this partnership will enhance our ability to deliver on our commitment to the community. And it's really important for everyone to know this. And so as far as I am concerned, this is a historic day for Nashville itself, for Meharry Medical College, and it might even create a new model for educating young people that other places might want to follow. And I like the idea of leading the way. That has a certain appeal to me, and that's what we're doing. This might become a model for other communities who would choose to do the same thing. And finally, on behalf of all the Meharrians, I want to point out to all of you how proud I am of my team and the staff members of Meharry who rose to the challenge. Back in February, I gave them a charge that we had to find a solution to this problem. And boy, they worked their tails off. And here we are today. And I just want to say thank you to all of them and how proud I am. Can you just give them? honored to introduce one of the true giants in terms of leadership in healthcare, my new colleague and partner, Mr. Milson Johnson, the CEO of HCA.
It's an absolute pleasure and honor to be here today to share this historic day with you and our announcement of our partnership. And I can tell you on behalf of the entire HCA team, we're excited to be part of this and look forward to years ahead of continuing to work with you and to work with your students to train the best physicians that we can possibly train together. My comments will be very brief, but they're hopefully meaningful and heartfelt. As Dr. Gilbert indicated, HCA and Meharry, we have a long relationship, actually going back over 4 decades. Our first CEO and founder of the company, Jack Massey, was on the board of Meharry. Our second CEO, Don McNaughton, was on the board of Meharry Medical College. And as Dr. Gilbert mentioned, today our Chief Medical Officer, John Curlin, participates on the board of Meharry. So we've had a long relationship going back over 4 decades. So this is like a natural evolution of continuing to strengthen that relationship over the decades ahead. We have, when Dr. Gilbert came to me and asked me to consider providing this opportunity for really, his number one objective was to do this for the students in Meharry. That's all he was thinking about. How do we help the students in Meharry in this situation? So we were very pleased to be able to do that and to be able to work with Meharry and the students involved in medical education. At HCA, we today, in other communities, we train students, residents, number over 3,000. So we know how to do this. We do it on scale, and so this is not something new for us, but something that we're incredibly looking forward to expanding here in Nashville, and especially at TriStar Southern Hills. So again, we see this just as agreement as just a natural continuation of our medical education strategy and a natural step in our long-standing relationship with Meharry. So we're so pleased to welcome Meharry students to TriStar Southern Hills Hospital, and we look forward to many of them ultimately, hopefully, practicing HCA hospitals in the future. So thank you.
Welcome to our city's leader who's taking us to new heights of achievement as a city. It's my honor to welcome Meharry.
Well, thank you. It is a wonderful day here at Meharry. It's a pleasure to be with all of you. We're also joined by several other elected officials who I want to give a quick shout out to. We have Representative Brenda Gilmore who is with us. Who serves on the hospital authority, who's also with us today. So it is wonderful to be here, and it's great that we get to have this very important announcement for Meharry Medical College and the great opportunity that the students are going to have to now hone their skills at a local area hospital while also giving HCA access to what I believe are the best and the brightest medical teams. This press conference today is here to talk about this new relationship between Meharry and HCA. I know that there's a topic that we also can't shy away from, and that topic has been a discussion in our city for decades, and that is the partnership between Meharry and Nashville General Hospital. and of course our continued challenge to find a model that works for both and works well. We know that Meharry and Nashville General Hospital have played incredibly important roles in our city and have long histories here. Meharry has been a valuable part of this community for more than 140 years. They have trained doctors who have provided medical care throughout our nation, including many to our underserved population. And for many years, Meharry was one of the only options for African American doctors and nurses who wanted to provide care and comfort and wanted to provide that for the members of our community. And as an institution, Meharry is invaluable for Nashville's story. It's part of our past, it's part of our present, it's also part of our future. Nashville General Hospital has been the city's safety net hospital and has served that as the index teaching hospital for Meharry since 1992. And that partnership has had its challenges. But throughout its duration, indigent care has always been the primary focus. I've stated many times, I am committed to safety net care for our community, but we have to do it in a way that provides the best healthcare outcomes for the populations that are served, making sure that we are also understanding that resources are not unlimited. Since 2005, Metro has provided more than $500 million in subsidies to support the operation of Nashville General Hospital. It is my job as mayor to make sure that the tax dollars that we are allocating for indigent care are used wisely and also benefit the most people. Metro has tried to make General Hospital sustainable. It's been an inpatient facility for the past 20 years, but that sustainability just has not materialized. The current daily census at the hospital is about 1/3 of its licensed capacity. That is a reflection of the fact that Nashvilleians are receiving care throughout our community. They're going to other facilities. That also means that of those 120 licensed beds on an average day, only 40 are being used, and 20% are of those used with an inmate care contract. That is not because of a lack of effort by the hospital authority. Let me tell you, the hospital authority has been very committed to this. It's not a lack of leadership at General Hospital. It's not a lack because of the deep care that Meharry has given or Metro officials. Nashville is a vibrant market. It actually has a competitive market for healthcare services, but it also faces a lot of the other challenges that many other healthcare systems and communities are facing across the nation. So strategies and proposals have been put forth. We've employed many different ways to try to improve the payer mix. We've incentivized Metro employees to use the hospital, but none of those incentives that we've given have actually achieved the goal of a sustainable operating model. And given the many healthy, competitive options in Nashville, other options have been where people go. So I have to say first, we owe a huge debt of gratitude to the citizen volunteers who have devoted countless hours to the safety net care with the Metro government. And that means all of the members of the hospital authority. That hospital authority is an all volunteer board. That means they don't get paid. And that means that they have to get up every day and are strong advocates for safety net care. And the board has worked tirelessly over the past several months to improve the financial accountability at Nashville General, and they've also spent a lot of time positioning the hospital to transition into a new phase. I would like to thank Kevin Crumbo for his restructuring help. He's volunteered lots of hours to get us to this point, as well as all of those who helped facilitate this. With the announcement that Meharry and HCA have reached a partnership agreement, which is exciting, that means that we have an opportunity now to also revisit the operations of Nashville General Hospital. And we have a way to restructure this in a way that promotes better healthcare outcomes for the residents across North Nashville and our entire community. At the same time, it also means that we can have more strategic investments in resources to provide that care for the Nashville indigent population. I believe that now is the time for a new model. It's a model that's going to be focused on providing preventative care so that folks do not need inpatient service. And it's also going to ensure that the more than 90% of the patients who are currently using Nashville General Hospital for their outpatient health care still receive this same or better care at that facility. Later this year, my administration will submit a substantial request for supplemental funds that will stabilize Nashville General's fiscal situation so that the hospital can improve services while also meeting its financial obligations throughout the rest of this budget year through June of 2018. And then throughout the next upcoming Metro budget cycle, Metro will work with stakeholders toward the goal of refocusing Nashville General Hospital's operations to an ambulatory care model that provides high-quality clinic and other outpatient care services. We'll also create an indigent care fund to ensure that all of those who are currently using Nashville General will still have their health care needs met either at Nashville General or at other area hospitals. This is going to result in better health care outcomes for the patient population served. Now, this new model, I think, shows that we as a city can be financially committed to better health outcomes. It's also a way to restructure that commitment in a way that results in the best health care outcomes for our community. And it's also going to provide stable funding that won't require Metro to sacrifice services in other areas of government or possibly raise taxes so that we have to provide that care. Now, I have to tell you that I get to share the stage today with two incredible leaders. Two incredible leaders who got together and saw a problem and solved it and said, this is what we need to do together. And I know that as we continue to have these conversations, I look at Dr. Hildreth and I think, this is Dr. Hildreth excited. And I know that this new sustainable model is also going to ensure the continued success of Nashville's historically Black medical college, while also making sure that we have a working framework for Nashville General Hospital, and that's going to reflect well on our city. So it's going to take all of us, though, to work, and it's also going to take a lot of faith. It's going to take a lot of good intentions, and I know that the folks here care deeply about making sure that this is successful. So thank you again to Dr. Hildreth. Thank you again to Milton Johnson. Thank you to your boards who have come together. And thank you to all of you today who absolutely get up every day and provide the best outcomes for our community for healthcare. Thank you.
So that concludes the announcement. I want to thank all of you for being here. And there might be students and faculty who want to stay a little longer to have some questions answered. I'm going to be sending a letter out to the whole campus shortly. It might have already gone out as we were talking, laying out some of these things and what they mean. But in the meantime, Dean Lima, the Senior Vice President for Research and Dean of the School of Graduate Studies and Research, and Dean Sheree from Dixon, kind of hang around for a little while. If you have some questions, we'll linger and talk with them if you can. But this concludes our announcement, and thank you all for being here very much.